I don't have concerns because insurance is very distinct from as are many other European countries. And if you learn any of those things, Obama is making a number of things that we see. But the answer is on the place on the current thing. How the hell is it going to happen? As you've heard, from holidays like Thanksgiving last year, Christmas last year, are really grown for massive spikes in cases depending on the social city that occurs. You remember the spring party early this month, we some of these areas tell us 2 weeks after the outbreak of the virus. So in terms of how many health officials urge up against follow all health protocols during this upcoming period. Take a closer look at this package of back to the shooting line. Slide them to the side. Slide that one to the side.
Oh, okay, great. Good morning, Honorable Prime Minister Dr. Hubert Minnis, Honorable Minister of Health Mr. Renwood Wells, other Honorable Ministers, officials of the Ministry of Health and other governmental agencies, PAHO WHO colleagues, other specially invited guests, members of the media, thank you for being here. To date, globally, there's been over 127 million cases of COVID-19 and more than 2.7 million deaths globally. And about half of these cases and deaths have occurred in the Americas where we sit. Globally, after 6 weeks of declining cases at the start of this year, the cases have been steadily rising since the middle of February. The decline in deaths has also been reversed. Last weekend, in the Americas alone, there were more than 330,000 cases and more than 9,000 deaths on the weekend. This virus has impacted every age group, every race, every gender, and every economic level. These are worrying trends as we continue to see the impact of the variants, the opening up of societies, and the inequitable vaccine rollout. We must continue to take the COVID-19 virus and this pandemic seriously. This is still a very active public health emergency. The COVID virus is not disappearing, nor is the pandemic starting to go away. The start of vaccine rollout is obviously a hopeful step in the fight against the virus, and PAHO is proud to facilitate this urgently needed effort in the Bahamas and indeed in the Americas. Thus far, more than 400 million vaccine doses have been given, and in the Americas, more than 155 million doses. PAHO has supported the Bahamas in developing the national vaccination plan so that the population can be vaccinated in a sustainable, effective, and safe manner. PAHO continues to offer technical cooperation for vaccine procurement, delivery, and deployment. We distribute guidance documents, train medical personnel, and offer direct advice on public information campaigns. Now, while there's reason for hope, we must always remember that the vaccine doses are limited, and it will be several months before we can rely on vaccines alone to control this virus. Although scale-up of vaccination production has begun, we know it's not enough. We do not yet have the vaccines that we need to protect everyone. It's what happens when the whole world must rely on too few manufacturers. Our goal at this time must be to save as many lives as possible by prioritizing the early doses for those who are at highest in risk of infection, of hospitalization, and of death due to this virus. We must also protect our healthcare workers and reduce the strain on our health system. The arrival of this 33,600 COVAX vaccines in the Bahamas today is a historic milestone, as well as the culmination of months of negotiation and a level of commitment to global solidarity. Another 67,200 doses are scheduled to arrive in the Bahamas in May. The pre-qualification of vaccines being supplied through COVAX allows PAHO to offer vaccines with the highest effectiveness and safety standards. Vaccine supply through COVAX will steadily increase month by month, with some 280 million doses expected to arrive in Latin America and the Caribbean by the end of 2021. COVAX is the best option to offer vaccines with equity. The goal of the COVAX facility is to provide vaccines for at least 20% of the population in each participating country globally, with the aim of protecting those most at risk and saving lives. In the words of the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, no one is safe until everyone is safe. And these WHO-approved vaccines are safe and they work. When the vaccine becomes available to you, don't hesitate. I encourage you to get vaccinated. The benefits of taking the vaccine far, far outweigh the risk. The COVID vaccine is an important tool in our fight against the COVID-19 virus and will help to save lives and eventually halt the pandemic. However, once the virus is still circulating, we must maintain public health measures that we know limit our exposure to the virus. Sticking to the protocols that we've been practicing for many months now are physical distancing, limiting gatherings, consistent use of masks in public settings, frequent hand washing, and not touching our faces. These are tried and tested measures that work in reducing the number and spread of COVID-19 infections. So as we approach these Easter holidays, let's keep these things in mind and keep ourselves and our loved ones and our communities safe. As we continue our efforts to reduce the transmission of the virus and mitigate the health impact of COVID-19, PAHO WHO pledges to continue to lead efforts in the region to support countries and territories in their response to this pandemic. I thank you very much.
Very well done. Well done. Ladies and gentlemen, the Most Honorable Prime Minister.
Yeah, thank you. Hiya. Thank you very much. Before I start, allow me to Allow me to thank and congratulate my Minister of Health, the CMO, the PAHO representative, and my Minister of Foreign Affairs, who were very aggressive and persistent in ensuring that these vaccines arrive here in the Bahamas. And in fact, they were tracking it from the vaccine had left to its arrival here in New Providence. So I want to thank them for the outstanding job that they have done. Ladies and gentlemen, good afternoon. The Bahamas received its first batch of COVID-19 vaccine in March of this year on the 10th. That batch of 20,000 doses of the AstraZeneca was generously donated by the government of India to the Bahamian people. I am pleased that today the Bahamas has received 33,600 doses of AstraZeneca COVID-19 vaccine through the COVAX facility. And as of today, we have received 53,600 vaccines. The batch we received today represents the first tranche of a total of 100,800 doses earmarked for the Bahamas and prepaid through the Pan American Health Organization revolving fund. The AstraZeneca vaccine does not require ultra-cold storage like some of the other COVID-19 vaccines, and because of this, they are easier to transport in cold boxes to our family islands, resident facilities, and inner city communities. This allows us to increase access to the vaccine and equitable distribution. Vaccines approved for the Bahamas must be certified by the World Health Organization pre-qualification process. The vaccines must have emergency use listing through the European Union and emergency use authorization through the Food and Drug Administration of the United States, or stringent regulatory authority through the Caribbean Regulatory System approval. Vaccination against COVID-19 is one of the ways to stop the spread of COVID-19 and to save lives. Vaccines will allow us to manage the transmission rate of the virus in our communities. Vaccines will allow us to protect our loved ones from having to be hospitalized, particularly our elders and senior citizens. Vaccines will save lives, and the life saved may be yours. As more people become vaccinated, we will be able to relax restrictions and see more of our family islands and friends in those respective islands. We will be able to open our economy more and to get back to work. Health officials have informed me that they are pleased with the number of people who have taken the vaccines so far. And let me thank the children, friends, and neighbors of older citizens for bringing them in to receive the COVID-19 vaccine. Ladies and gentlemen, even as more of us receive the vaccine, we must still adhere to the other life-saving health measures. It is important that you continue to wear a mask, wash your hands, and keep a distance of 6 feet from others. It is also important to avoid large gatherings. I repeat, it is extremely important to avoid large gatherings. Easter weekend is traditionally a time of family gatherings and fellowship, including beach picnics. But we are still in the midst of a pandemic. These are not normal times. The COVID-19 case numbers in the Bahamas and around the world make it clear that the pandemic is not yet over. I wish to remind you that under the emergency powers orders on New Providence and Grand Bahama, groups at all beaches and parks are limited to 5 per group. COVID ambassadors will monitor beaches and parks to ensure enforcement of our emergency orders. Large gatherings over this weekend could set the country back. If we continue to exercise discipline for a longer time, we will reap the benefits. If we continue to practice the preventative health measures and at the same time vaccinate more people, we will move even quicker toward a broader reopening of the country. We will get there in a shorter period of time if we do not have to control outbreaks. We cannot afford a painful third wave, and therefore we all must and have to do our part. We don't want another surge in cases here in the Bahamas. This will result in more hospitalizations and more deaths. At this time, health officials are managing outbreaks on Eleuthera and Grand Bahama. And the vaccination program will be accelerated to address the increase in cases. Surveillance efforts will also be stepped up on islands where an increase in the number of cases is being recorded. Vaccinations are starting on Eleuthera today, Tuesday, March 30th. They will continue through Thursday, April 1st, starting with the healthcare workers, residents over 60, and staff of the uniformed branch. Vaccinations on Abaco and Bimini are expected to start next week after the Easter holidays. We want to contain those who have the virus and offer the best care to the population so that they won't have to be hospitalized. Health officials are closely monitoring developments, and assessments are being carried out on islands where outbreaks have been recorded. Following various assessments, which should come in early next week, we may take further steps based on the findings. Vaccinations will continue this week on New Providence, Grand Bahama, and Eleuthera, leading up to the Easter holiday. And after the holidays, vaccinations will resume on Wednesday, the 7th of April. At that time, those with disabilities, teachers, and hospitality workers will become eligible to receive the vaccines. Additional vaccination centers will be opened on New Providence, and provisions will also be made for students and athletes who require vaccination to travel abroad. This will include coaches and other support staff. More information will be provided in the coming days on various details of our vaccination program. Ladies and gentlemen, since the COVID-19 vaccination program began on March 14th, more than 7,000 doses of the AstraZeneca vaccine have been administered on New Providence and Grand Bahama. And the highest number of COVID-19 vaccinations administered on a single day has been in excess of 1,000. To date, 63% of those who have received the vaccine are over the age of 60. Others vaccinated include healthcare workers and staff of the uniformed branches. 42% of those who received the vaccine were males, and 58% were females. Let me state again, the vaccinations will continue on New Providence and Grand Bahama from Monday the 29th to March through Wednesday the 31st of March, and on Eleuthera from Tuesday the 30th of March through Thursday the 1st of April. On New Providence, vaccinations for staff of the uniformed branches only took place Monday the 29th of March and continue today, Tuesday the 30th of March at Loyola Hall on Gladstone Road. Uniformed branches include the Royal Bahamas Defense Force, the Royal Bahamas Police Force, the COVID ambassadors, Bahamas Department of Corrections, Bahamas Customs, and Bahamas Immigration Department. And on Wednesday, March 31st, appointments at Loyola Hall will be open to the staff of the judiciary, uniformed staff branches, healthcare workers, and members of the general public over the age of 60. To receive a vaccine at Loyola Hall, an appointment is required, and vaccinations continue at the Church of God of Prophecy through Wednesday, 31st of March for residents 60 and older, healthcare workers, and staff of the uniformed branches. On Grand Bahama, the focus of the vaccination effort is on the east and west end of the islands at the start of this week and will continue at the Susan J. Wallace Community Center beginning midweek. Residents eligible to receive the vaccine should continue to check at our website doctorshospital.com/vaccine-registration for appointments as they become available. So let's repeat that website. It's doctorshospital.com/vaccine-registration. On New Providence and Grand Bahama, mobile units will also provide vaccinations to nursing homes and other residential facilities this week. For Eleuthera, including Harbor Island and Spanish Wells, COVID-19 vaccines will be administered starting with healthcare workers, residents over the age of 60, and staff of the uniformed branches from Tuesday, 30th of March through Thursday, the 1st of April. Clinic administrators will notify residents of Eleuthera of vaccination centers, locations, and times. The National Vaccination Program will resume following the Easter holidays. As scheduled, a schedule of locations and eligible priority groups will be shared with the public in the coming days. While it is understandable that there is a strong desire to return to normal, we must all remember that the pandemic is not yet over. We can see from around the world that the pandemic is in its worst phase in some countries. Last week, Pan American Health Organization Director Dr. Carissa Etienne discussed the challenges our region faces. The circumstances is dire in South America. There are problems in multiple parts of the Caribbean, and cases are increasing in areas of North America. Dr. Etienne described the situation as, and I quote, an active public health emergency, adding that as the virus surges and hospitalizations rise, we urgently need to scale up vaccination among our most vulnerable populations, end quote. The only way out of this pandemic is through vaccinations. Anyone who tells you otherwise is providing you with absolute false information. What has worsened the situation is dangerous variants have emerged and they are spreading around the world. These variants are more infectious than the earlier versions of the virus, and scientists also think they cause increased sickness and more deaths. Here at home, we are in a race. We must get as many people vaccinated as soon as possible before there is spread of one of these problematic variants in our country. And as I mentioned before, the Bahamas has a poor health profile due to our struggles with obesity, hypertension, diabetes, and other chronic non-communicable diseases. And COVID-19 is particularly dangerous and potentially fatal to people who have these conditions. Thousands of Bahamians have taken this vaccine, along with approximately 400 million people around the world. I have taken the vaccine, my wife have taken the vaccine, and as you can see, I am fine. In order for us to prevent additional bad waves of the virus, we need Bahamians to quickly come forward to get vaccinated when eligible. The vaccine is our pathway to further opening up our economy and creation of more jobs. It is dangerous to delay taking a safe and effective vaccine during a global health crisis. As you wait, you can get infected by this virus. You could then end up in the hospital with permanent health issues, or worse still, it could kill you. The virus remains dangerous and is random in who it infects. Having COVID-19 could set you back for days, weeks, months, or even many, many years. So, ladies and gentlemen, I want each person who has been vaccinated to call a friend and family members who are eligible but hesitant to take this vaccine. Share your story with them. Explain the process to them. Assure them that the vaccine is safe. Such words of encouragement coming from a close friend or relative might be the difference in helping that person to come forward to take the vaccine. So let us be a community of encouragement. Let us urge those we love and care to take this life-saving vaccine. I was recently told of a story of a son who took his 92-year-old mother to get vaccinated. She was so relieved and overjoyed to get the vaccine that she called up her friends and told them all and tried to encourage them all to take the vaccine. And over the course of several days, her son got a number of calls from other members of the family and his grandmother's friends telling him that they wanted him to sign them up to receive the vaccine. Her son says that he has now become the vaccine secretary for the family, as he has a lot of work to do. His mother says she took the vaccine because she remembers people who suffered from the effects of polio, measles, and other diseases because they never got vaccinated for these diseases. Those who do not remember those times and who refuse to get the vaccine may have to relive history and experience for themselves the effects of COVID-19, which we know is causing long-term physical and mental illness. In the spirit of wisdom of this 92-year-old Bahamian mother, grandmother, and great-grandmother, let us play our part in being our brothers and sisters' keepers. I want to thank the Vaccine Committee, the frontline healthcare workers who are administering the vaccines, and the civic groups and volunteers who are assisting in the process. You have come forward to help Bahamians during the worst crisis in our country's modern history. And as I speak here today, I want to ask more volunteers to come forward, because we need as many volunteers as possible as we continue to open up other vaccination centers. It is important that we remain resilient. The virus is still here. As more vaccines become available and more Bahamians vaccinated, we will put this pandemic behind us. And let me end by offering a brief Easter message. This week we celebrated Holy Week, commemorating the passion, death, and resurrection of Jesus Christ, who gave his life so that we may be redeemed and have eternal life. As Christians and people of faith, we do not live for ourselves alone. We live for others. In the imitation of Christ, we are called to act Christ-like in caring for others, especially the poor and the most vulnerable among us. It is in this spirit that many religious leaders have invited others to take the vaccine in order to protect yourself and those around you, as well as the greater common good. Easter is a celebration of new life and the hope of the resurrection. On my own behalf and that of Patricia, may I offer Happy Easter to each and every one of you. Thank you. Good afternoon. Enjoy the hot sun, and may God continue to bless each and every one of us. Are there any questions?
What is your reaction to this, that Bahama might be at the start of the year? And do you plan to enact any restrictions for that act?
I think we have a very efficient and effective medical staff assisted by our PAHO representative, and they have monitored the situation, and both I and they are convinced that once we aggressively continue our contact tracing, aggressively isolate those who are infected, and aggressively vaccinate the population as much as possible, I think we can avoid that. And your other question was whether I would introduce any curfews or any stringent measures. I am advised by the health professionals, and they would do their data collection, they would do their analysis, and they are guided by the science, and they would advise me as to the way forward. What I can tell you at this point in time, this is Easter, and Bahamians love beaches. We do not want to discourage them from going on the beach, but I would discourage them to avoid the large mass gathering that I've seen just recently and I've seen in the press, as that simple gathering can cause our entire country and economy to go in a tailspin and backward from whence we came, especially at a time when we're now growing. And I would advise that for those that are in groupings, allow that group to be only household members, family members. Do not allow strangers or those who you don't know within that grouping. If we were to make the sacrifice in terms of the mitigation processes that the health professionals and the World Health Organization had introduced, if we were to follow those procedures and do our part, and each citizen be a soldier of the Bahamas doing their part and stopping individuals from gathering, if we were to make that sacrifice for an additional 2 weeks, then we can have a beautiful independence and a marvelous and splendid Christmas.
Global supply shortages, are there concerns about receiving the remainder of the COVID-19 vaccines from the COVAX facility? And what's the contingency plan if they don't arrive on time as far as a second dose for those who take it?
As you know, before the vaccines came in, we were able to conquer the COVID disease by just following the mitigation protocols and following the laws and enforcing the laws. The vaccines are to rescue us, but we still have to follow those protocols. So we would still follow those protocols, and we would still pursue obtaining more vaccines. And yes, there may be a delay, but I always give the perfect example. Imagine you're running the 100-meter race. you want to reach the finish line. COVID is in lane 4, and the vaccine is in lane 5. COVID want to reach the finish line, and the vaccine want to reach the finish line. Whoever reaches the finish line first is victorious. The vaccine, the professionals and the government would utilize all its resources to purchase, to find, and deliver to you. But COVID is still in lane 3 or 4 running. The only person or individuals that can slow COVID down is you, the Bahamian people, by utilizing wearing masks, social distancing, and sanitization. Only you, your support, and enforcement of the laws and the orders can slow COVID down. So if the Bahamian people did their part in slowing COVID in lane 3, we will do our part in accelerating lane 4 and let the vaccine reach the finish line before COVID. So as I speak, I ask you all just to do your part. Another 2-3 weeks and we'll be okay.
It's not to gather in groups of more than 5 when...
I can hear you, sorry.
I'm sorry. What would you say to those who say that you're asking people not to gather in groups of more than 5 when over the past few weeks we've seen political parties out campaigning in groups that were clearly more than 5?
But you would have seen them still spacing out somewhat, and each and everyone, regardless of the political organization, each and everyone were wearing a mask.
So, is the government considering requiring visitors to be vaccinated?
Pardon?
Is the government considering requiring visitors to be vaccinated? I know that Bahamas Air said that they were in discussions on that topic.
That matter has not been discussed yet, but at the health level nor at cabinet. But once that is discussed and decisions are made, you would be the first to know. Thank you very much. Do enjoy the rest of the day. Royston, have an excellent Easter. Enjoy the beach.